Doctor, why isn't there one place for people to call or sign up for a vaccine, right? You announced the state-run sites, there'll be a phone number and a website for that. The pharmacies have their own system. The cities and towns have their own system, and there's dozens of those among the cities and towns. Why not just streamline it into one place people can call so they don't have to sign up at multiple places like you said last week and try to navigate all this themselves and get some help, especially the elderly?
That's an excellent question. For right now, we want to make sure that accessibility is the focus, particularly for our seniors. And so being able to reach out to your retail pharmacy is something that people are familiar with. If they need to get a flu vaccine at CVS or Walgreens, they would follow the same process to go ahead and get a COVID vaccine there. So the retail pharmacy piece is distinct. For our focus right now on the 75-year-olds and older, we do have a variety of approaches, and it's really a credit to our cities and towns who are actually doing the registering for our seniors in many situations, taking the time to do that. So we are continuing that type of approach there, and then those seniors who will be able can go ahead and do the state run where we'll have more volume going through. As we move forward and start to extend out into further groups within Phase 2, we will work towards a more focused approach across all of our government interfaces. But for right now, want to keep it local and knowing how much the cities and towns are doing for the seniors to make it as easy as possible for them.
Do you know yet a percentage of how many of those 75-plus population have tried to sign up or are waiting to get a vaccine, and how many actually have at this point?
Yeah, through our cities and towns, they are pushing out all of the vaccine that they have access to, and have really been providing the true supportive services for our seniors that we want. So I'm confident that the additional 7,000 plus that we will be pushing through cities and towns are going to get to every senior in their local community that they are reaching out to.
On that, do they have different channels of access to vaccine at the city and town levels than you do at the state level? Why this disparity between cities and towns, states, pharmacies? Why this disparity?
So this is not at all a difference, or the term that you're using. The oversight of yep, it is not that. The oversight of our distribution of vaccine is fully controlled through the state. It's really a true form of equity in terms of making sure that those who need to have the particular access are doing it. And I'll again, thank our cities and towns that are doing a great job registering for seniors and really helping the support make sure they get it. And the vaccine supply that they're getting are coming from us.
What is the philosophical underpinning to that?
To help make sure that seniors have the access they need. To help make sure that seniors have the access they need.
Doctor, good afternoon.
Good afternoon.
Massachusetts announced that they're going to allow caretakers who are taking the older people to be able to get vaccinated. It seems a little bit more streamlined. Is Rhode Island going to follow suit on that?
At this point, we are focusing on the seniors. I do appreciate that approach, but with our limited supply, particularly given that we historically had even a smaller amount to get to the public, we wanted to continue to focus on the seniors themselves. As we start to get more supply, we will look forward to having more creative access for additional members as well.
I still get a lot of email about nursing homes. And given the fact that everybody's been vaccinated and the front care workers, have you had any outbreaks at the nursing homes? Is it way down?
The cases have decreased.
Right, so they want to know, loosening up, visitation and all of that a lot of these seniors literally are dying of loneliness. It seems there's a lot of CYA on the nursing home owners, that unless you bring the hammer down on them, they're taking the path of least resistance. Oh, we really don't want to, get in trouble and all of that. So again, what directive and discussions have you had from the Department of Health telling the nursing home facilities you really need to start loosening things up, given that you follow the science and the data, and that seems to be trending in a positive direction?
Absolutely. We have had in place the caretaker approach and the other strategies to help address the importance of seniors being able to have the visitors, and have really pushed that with our nursing homes. Now that we are coming on to the final parts of the vaccination process with our long-term care facility, there's still some more facilities that need to be included. It is the right time to start engaging further about how to more systematically expand the visitation restrictions.
One more quick question. Are you using the field hospitals at all right now?
Somewhat, to a lower extent.
And why are you using them when the hospital, it looks like the hospital count is way, way down?
Yeah, it is a very minimal number. We are working closely with the hospitals on when they may actually need to, but we also are really focusing on preparing for what could happen with the variants coming and understanding how soon that could be. We're doing our best to try to push that out while providing for the business support that Secretary Pryor discussed earlier.
Doctor, for months we've heard about, for almost a year, we've heard about bars being amongst the most dangerous places when it comes to COVID-19. So now we're reopening here just as we hit a low weekly percentage. So who exactly, from a scientific, not a commerce or industrial standpoint, but from a scientific medical standpoint, sat around the table and came up with these decisions as far as the reopening? I mean, I'm already getting at least a dozen messages from people who work in restaurant or bar environments that are saying, now I'm scared to go back to work.
Yeah, these are very tough decisions. And from a public health standpoint and partnership with our commerce colleagues, we constantly have to balance. Public health includes health and health care, and it also includes our economic health. So really being able to assess where we are with our data. People have done a great job in getting our percent positivity down. And then also, as you can see from our loosening of the restrictions with bars, how still extremely cautious we are in making sure that tables are still 6 feet apart, in making sure that it's still seating, dining services in place, and making sure that there's a limitation on the time frame to 90 minutes or less, as well as working with businesses on improving ventilation. We want to do everything we can to avoid it being a super spreader event. There's no mingling, there's no standing at the bar, the plexiglass is still there in between that and the bartender. So it's really being thoughtful. It's hard, you know, to take that approach, but we also understand what our business community has been experiencing and want to continue to find that balance with the expectation that as soon as we see spread of cases, increased outbreaks, evidence that we have a more contagious virus in place, we absolutely have to close this.
Medical experts by name or organization have signed off on this plan that are not inside the Department of Health? Who have you said that there was a consultation that took place to arrive at this. We've heard the Ocean State Coalition, etc. But did someone from Brown University, did anybody who's conducted a study in a medical perspective say that this was a good move?
Yeah, our approach all along has recognized that the data and science has to be balanced with what we are facing. We have public health advisors that we engage with and have throughout this event and have appreciated their input. And at the end of the day, with the governors, we've needed to make the decision that's best. With all of the cautionary steps that I have expressed that are in place, and the clear understanding that were we to start seeing increases in cases and we would need to pull this back, this has been something, this has been the path and the direction that we've taken temporarily for now.
Restrictions as currently constituted beginning on the 12th. Theoretically, somebody could have a concert at a bar on the 12th. You could have people gathering around the bar, performance. Is that something that's medically acceptable if that's the case for that to take place? Is that what you're saying?
No, our requirements with these restrictions continue to be seated. It's similar to what's happening in the restaurant dining area. There continues to need to be spacing in place. The limitation on timing is a new component we're adding. The ventilation guidance is a new component that we're going to be pushing. So we absolutely are doing this carefully, supporting the businesses, but doing it in a way that minimizes the real risk when congregating indoors with inconsistent groups happen. We absolutely want to avoid that.
The oversight of this.
We have that oversight.
Doctor, I have a question for Governor McKee. If you could come up to the podium. Governor, Rhode Island has lagged other states in delivering the COVID shots. Through Monday, we had the 4th lowest share, population vaccinated, 8%, according to the New York Times. We were dead last among states in percentage of vaccine doses used. Governor Raimondo the other day mentioned that there were some kinks in dealing with CVS and Walgreens. In layman's terms, are you familiar with what those kinks are? And if you could explain to Rhode Islanders what's being done to rectify it.
Yeah, so there's national agreements in terms of the way that the pharmacies are working, and that the states that have, made arrangements with the pharmacies, which Rhode Island was one, are lagging. But I see that the work that's being done now is going to accelerate that. And just like the testing, when the testing was lagging and the state organized and then launched it, and now we're #1 in testing, I would, in my anticipation, would bring in the municipalities in, the state sites, and then working directly with the pharmacies, that those figures are going to change very dramatically and very quickly.
The governor also, Governor Raimondo mentioned she contacted a CVS executive over the weekend. Were you aware that it had reached that point? Had you thought of injecting yourself, or is this still your restrained from doing that because of the current situation?
Yeah, the governor, I know, and informed me that that contact was going to be made, and I also informed her that we were going through our channels nationally to do the same thing.
And you're confident that Rhode Island will move from being dead last with the percentage of vaccines used?
I think the plans that we have in place right now, bringing the municipalities in, setting up the state sites, and like starting at the Dunkin' Donuts Center, and then along with the pharmacies, I think that you're going to see a rapid increase. And also, remember, we vaccinated certain specific types of individuals, and now when we're rolling into the age groups, you're going to see that that's going to flow fairly quickly, and then we're going to get into the 65 and older at the appropriate time. I think that's a few weeks down the line. But when that happens, you're going to see the state really functioning the same way it did on the testing.
Yeah. Okay, Dr. Nicole Alexander Scott, I have a question for you. With February break starting Monday for schools and the potential for travel, is there any indication as of now that the Department of Health will require school districts to implement a quarantine after the break?
No. At this point, we are continuing to work with our school community to make sure that the testing services that are available and access to all of the resources with our Education Operations Center will continue, and make that available for the school community as well.
Governor McKee. Excuse me, sorry. Despite a $1 billion plus cash infusion by the federal government, clearly not enough has been done to provide for small business. In one case, which I document on our website, a check for $250 for a single location of a multi-unit chain restaurant, and a case overall of $20,000 was received for a business that realized a loss in sales of over $2 million. Meanwhile, Commerce Corporation recently announced the creation of a $36 million loan to what is now referred to as #38Soccer, aka Tidewater Landing, for the benefit of developer Ford and his partners. My question, given the ease, or the relative ease, at which the availability of this credit line was generated and its generous repayment terms, will the government of Rhode Island create a $50 million line of credit to support the existing locally based business community with similar repayment terms? Sales tax collected by these businesses will be used to repay their credit lines.
Yeah, so you're not telling me anything we don't know, right? We know that the businesses, small businesses needed more of the CARES Act dollars, and I intend to do a review of how the CARES Act dollars were spent and then appropriate those funds to the businesses in the form of grants. I've also been on the record to talk about that the small businesses need a long-term strategy in terms of a loan program. So we intend to bring all the CEOs of banks together along with the SBA to talk about a state-guaranteed and a SBA-guaranteed loan program like you're talking about. So, and then the other thing, while I got the attention of the small businesses out there, that thank you for doing that, is that the PPP loans are critical. So right now we're approaching over $800 million of PPP loans that have gone out. That's the SBA program, right, the payroll protection plan for the small business. We need to drive that up to $2 billion or more like we approached in the first round, and we can do that. But every business out there that qualifies, we want you to apply for that PPP loans. That's going to bring far more resources than what we can put on in terms of the CARES Act. We're talking about billions of dollars there. We're talking about tens of millions of dollars in the other place. So,
respectfully, and you've been on the forefront of this to your eternal credit. Right? We're talking about a government that right now, and we've had 8 or 9 months to talk about this, think about this. We've had 8 or 9 months to create a plan. And yet, seemingly, without any hesitation, the state's willing to offer $36 million now to fortuitous partners, with nearly sales tax being the repayment for it.
Okay, so
where's the justice in that?
We're going to talk about the COVID right now, but I'd be happy to follow up because you and I have disagreed on this for a long time. They're two separate issues, and the small businesses are absolutely a priority in my new administration, and it will continue to be as it has been in the past.
Why does one business get those raises and regular Rhode Island businesses don't?
My question's for the doctor. You said last week that the restrictions could be temporary on businesses. I'm wondering what the threshold is that you're using for, we have to hit this percent positive for us to start cracking down on restrictions. Can you share exactly what it has to look like here in the state to do that?
It's essentially what the trends of our cases, our percent positive, our hospitalizations, and our overall outbreak response will show. If we start to see indicators that reflect a more contagious virus being present, clusters of cases, outbreaks occurring, that in addition to identification of the virus, the variant strains via the sequencing that we're doing, all would be support for showing it's going in the wrong direction and we need to make an adjustment. It allows us to talk about why testing is important, treatment is important, as well as the vaccinations.
Doctor, one quick question. In terms of limitation of timing at the bars, is that new? Is that what you said? That's a new thing? And do patrons have to order food at the bar to be there like they once had to?
It is restaurant-style dining only at the bar, so they should be eating.